To speak on some of the data being presented in ovarian cancer research this year, we speak with Dr. Shannon Westin, who is the Associate Professor in the Department of Gynecologic Oncology and Reproductive Medicine, Division of Surgery at the University of Texas MD Anderson Cancer Center. Hi, Dr. Westin.
Hi, thanks so much for having me.
Sure, thank you for being here.
Yeah, it's exciting.
So we have a lot of studies going on this year at ASCO, of course. One of which is the Topacio KEYNOTE-162 study, which is exploring the combination of pembrolizumab and niraparib in both ovarian and triple-negative breast cancer.
Yes.
Could you discuss these findings of both of those cohorts?
Yeah, I mean, some of these data had been presented previously, so this was a really nice update of kind of the full cohort. But what we're seeing is the combination of the PD-1 inhibitor and PARP inhibitor seems to be synergistic, work better than either one alone. And importantly, especially in the ovarian cancer cohort, we're seeing activity in a BRCA wild type patient population. So we would expect a reasonable activity level in a BRCA mutant population because of PARP. But what we're seeing is importantly like almost a 30% response rate in those BRCA wild type patients. And so that's really exciting because basically we're overcoming some form of resistance, whether we're sensitizing to PARP or sensitizing to the PD-1, whatever the reason, it's really exciting because we like to see that kind of activity level.
Absolutely, definitely. Now, there's the phase 2 QUADRA study, which is exploring niraparib in heavily pretreated patients with ovarian cancer. What do you think it makes this study stand out?
I think similar to what we just talked about, this study looked at not only the platinum sensitive group, not only the BRCA mutant group, but also platinum resistant and platinum refractory, and also BRCA wild type. And they saw some really nice response rates. Of course, response rates were about, I believe, around 60 to 70% in the BRCA mutant population, which is what we'd expect, although in a multiple prior lines of therapy, that's really high, even in a mutant population. But importantly, in the wild type population, they saw some activity. And so I think that's really exciting to see that maybe we need to do a little bit better about selecting these patients and not just, write off PARP inhibitor therapy if a patient doesn't have a BRCA mutant population, mutant status. And I think that really reflects what we're seeing in the maintenance settings where we're seeing activity regardless of BRCA mutant status. So I think we're kind of scratching the surface of figuring out what patients may benefit from these drugs and really expanding the population that can benefit.
That's a great point.
Yeah.
Now there's also the MITO-MANGO study of chemotherapy plus bevacizumab following a bevacizumab regimen. So could you shed some light on those findings?
Yeah, we've been really excited about waiting for this study because one of the major questions we've all had is in this patient population that got bevacizumab maintenance in the upfront setting and then ultimately recur, should we retreat them with bevacizumab or not? And there are data in the colorectal literature that would indicate you should. So this study basically randomized patients that had previously been treated with bevacizumab and chemo, followed by a bevacizumab maintenance, and then recurred. And they retreated with bevacizumab compared to a group that they did not. And what they saw was there was a clear improvement in progression-free survival in the group that was retreated with bevacizumab. So very much reflective of what we've seen in the colorectal cancer literature and pretty exciting for our patients with ovarian cancer.
Nice. So what are some other trials at this year's meeting that really stands out, and what do you think this says about the way that the field is moving towards?
Yeah, I think the whole point of ASCO this year, the whole theme is refining that precision medicine, really pushing precision medicine. And so some of the things that really stood out to me is not only refining the way we treat patients from a therapeutic standpoint, but also surgically. So Dr. Coleman's data with GOG-213, which was looking at chemo versus chemo with bevacizumab, also had an arm looking at surgical cytoreduction. So is there a role for secondary cytoreduction in this population? And surprising to all of us surgeons, what he found was that the patients did not benefit from secondary cytoreduction. We've always thought if it's a small enough tumor, we should resect it and then give chemo. Those patients will live longer, but that is not what we found in this randomized trial. So I think for me, that tailoring of surgical therapy, that not just kind of sitting back and accepting the axioms and actually pushing the envelope. Similarly, out of Northwestern, they looked at minimally invasive surgery for radical hysterectomy. So they compared in a 1B1, stage 1B1 population, they looked to see if there was a difference between outcomes in open radical hysterectomy compared to robotic or laparoscopic. And what they found is in a population that had tumors between 2 and 4 centimeters, minimally invasive had worse outcomes. And that's shocking because we've always thought there's less morbidity, there's less cost, minimally invasive is the way to go. But they did not find that. And that actually echoes findings that were presented at the Society of GYN Oncology meeting in March. So again, more data indicating that we can really tailor the surgery that we do and make sure we're giving the right surgery to the right patients.
Wow. Okay, well that was great. Thank you so much for being here with us and shedding some light on all the research going on in the field this year.
It was my pleasure. Thanks so much for having me.
Sure, thank you.